So I'll be discussing about building your references. Personally, I feel that writing the bibliography or compiling references is the most boring part of any research paper. If we look at all the spine surgeons, there was a survey done by AO Spine, and it showed that only 4% of published spine surgeons are actually checking the citations of the articles that they read. There was one more paper which was published in the Global Spine Journal, and it showed that the errors in bibliography are as high as 23%. So I believe that all of us have been ignoring bibliography or the references, but they are a very important part of your research paper. References help to build credibility. So if you're citing good articles, that builds the credibility of your paper. It avoids issues of plagiarism because you're giving credit where it is due and acknowledging the original authors who did the work. If a reader is interested in further knowledge, they can find sources as a ready reckoner. They can go in and delve further into the topic based on the references that you have provided. References can be of various types. The commonest ones that we use are books and journal articles. So if you want to quote something with a historical perspective, probably the origin of a technique, there may not be an article quoting it, but you may find a reference in a good textbook. Journal articles are authoritative, they are peer reviewed, so these are the two commonest references that we use. Apart from that, for something that is fairly recent, not yet published, you can quote conference papers. There are other websites and online sources, theses. There can be government reports such as those published by the WHO, data sets and audits and multimedia sources. So these are some of the other sources for your references which are not so commonly used. So to write your references, I have tried to prepare a stepwise guide. So the first step is collecting source information. While you're writing your research paper, keep a track and compile all the sources that you're using. These sources should have all the basic information, that is the title of the work, the year of publication, what journal it was published in, and some access information like the DOI or the URL. The second step is choosing a citation style. So for majority of medical research, the citation style is Vancouver or the AMA format. So based on what journal you are going to publish, it would be appropriate to choose a citation style as per the journal requirements. There are a few other uncommon citation styles as well, so go through the journal requirements before zeroing in on the citation. Step 3 is formatting. So once you have chosen what citation style you are going to use, pay attention to the order of the elements, punctuation marks and italics. So this formatting that you use has to be uniform across all the references. Step 4 is using citation management tools. So all the work that we just did can be done manually, or you can utilize citation management tools. The common ones are Zotero, EndNote or Mendeley. So Mendeley is a very versatile tool for citation management. It's been around for a long time. It is compatible with both Apple as well as Windows, and you can directly sync it with MS Word. So ordering your references, choosing the citation style, a lot of it can be generated directly by Mendeley. The last step is reviewing and cross-checking your references. So even if you are using a citation manager, it is always better to actually manually cross-check so that every text in the citation matches a corresponding entry in the reference list. Some of the common mistakes that are done include using an incorrect format or missing some sources that you have actually quoted. One more thing is using outdated sources. So the field of spine surgery is rapidly evolving. Something that is true today may not hold true a decade later. So whatever you are citing should be updated and current. Overusing secondary sources. So that leads to an error which is called amplification. It is always better to go to the original article and quote it rather than using secondary sources. And the other errors are those of inconsistent style. So if you are not formatting them properly or using different citation styles, that is also a common mistake to be avoided. So this is how we usually do it. If you go to any journal website, this is the Indian Spine Journal. If you just click on for authors, there will be instructions to the authors. And in the instructions, the journal will clearly mention how they want the references to be written. And it's fairly mechanical and you can easily do it. So proper referencing has multiple benefits. It improves the credibility of your paper. It shows that you have ethical integrity because you're avoiding plagiarism and acknowledging the original people who worked on that. It makes your research transparent. So if a reader wants to cross-check or verify what you have written, he already has some sources from where he can check it. So for somebody who's a budding researcher and starting with his research, it is important to build reference libraries early. Even though you're depending on citation managers, it is always better to cross-check all your citations. All of us have seen the evidence-based pyramid, where we see the opinion of experts or case studies are at the bottom and meta-analysis and randomized control trials are at the top. So it is always better to use recent as well as high-quality evidences in your papers. So do not fall prey to some of these common errors in citations. So the first is selective citation or citation bias. So this error is when you only cite those articles which have findings that are similar to yours. So those that have positive results only will give probably a wrong idea to the reader. And the second error is opposite conclusion, wherein you directly cite an article that has a conclusion which is exactly opposite to what you are trying to say. The second error is Matthew effect. So Matthew effect is something like an Instagram reel that goes viral, where one paper has been cited so many times that everybody keeps on citing it, not regarding the level of evidence. So the paper may not actually be very good, but just because it's been cited many times, you keep on citing it. The third error that we sometimes fall prey to is eminence-based medicine rather than evidence-based medicine. So if there's a big name associated with a paper, or if it is coming from a very reputable organization, we may end up citing it blindly without actually going through the contents of the paper. The fourth error is amplification. So that is about something similar to secondary citation, wherein instead of going to the original paper, you're just citing something else which doesn't add to the primary data. The next error is backdoor invention, wherein you just cite an unpublished abstract, wherein the reader is forced to believe that it is actually a full paper. And as high as 26% of spine articles are still quoting retracted studies. So make sure that retracted studies are not quoted. We had an interesting discussion with Professor Tanaka and Satyan sir about the current role of AI. So there are a few tools that are there like Trinka, which helps with grammar. You have Scholar C and Semantic Scholar, which are free AI tools to generate your references. And then there is Cite AI, which helps you manage your citations. Some of these tools are so good that even if you put in a command that how many number of authors you want before putting in et al., very specific citations can be generated. But like the previous speakers mentioned, they are just a tool to guide you forward and you cannot completely rely on them. So to conclude, references are a must-have and essential component of your research paper. If you understand the type of references and follow proper formatting guidelines, you can do them easily. Citation tools and AI tools are your friends, so you have to learn them and use them wisely. Thank you.